Hey guys, Dennis here with Respiratory Sensei. Hey, I have here an ET tube with a cuff, and if I were to ask most of you what is the maximum cuff pressure you should not exceed, I've done this for a lot of years, most of you would tell me about 30 centimeters of water pressure. But what if I told you that's not exactly true? Because the reason why you think that is because of this. This is a cuffulator, and you'll notice in the green zone it tops out at about 30 centimeters of water pressure. But in fact, hemodynamically, we don't want to exceed about 26 to 27. So why do you think it's 30 if you do think it's 30? Well, here's the reason. It's because every time you take the cuffulator and you stick it in this little pilot balloon, it depresses that plunger, and in doing so, it releases a little pressure out. And then worst of all, as soon as you take off the cuffulator, it lets a little bit more air out. So one of the reasons why we think it's 30 is because the cuffulator, when you pull it out, is actually going to lower it by about 2 centimeters of water pressure. So if you see 30 and you take it out, it's really at about 28. 27 is actually the magical number. Some people learn 26. Now, why 27? Actually, if you really want to know, and you're on the NBRC exam, this is something you need to pay attention to. They are likely not to talk about centimeters of water pressure and maximum cuff pressure. On the NBRC exam, you need to use the number 20. And it's because it's 20 millimeters of mercury. Why do we talk about millimeters of mercury? Because that's a hemodynamic value. That's the pressure of the capillaries as it flows around the area of the cuff. And if you exceed 20 millimeters of mercury, which is equivalent to about 26 to 27 centimeters of water pressure, then you'll cause the blood flow to avoid that area and necrosis can happen. So on the exam, the answer to that is 20, but in real life, if you're using centimeters of water pressure, the correct answer is you shouldn't exceed 27 centimeters of water pressure. Use a cuffulator. As soon as you take it out, it's going to drop from 30 to about 27 or 28. So you're in the right zone, but the number's not actually 30. Okay, just a little interesting nerdy fact.